Well, good morning. It's Dr. Brian McKay, not just a chiropractor for Stamford, Darien, Norwalk, and New Canaan. And today we have a very interesting topic: breast reduction and breast reduction surgery. Now, what do you think that has to do with a chiropractor? Well, about once a month, I get a request to review notes or to do notes for a patient who wants to have a breast reduction surgery performed and have it covered by insurance. So it's usually not a simple procedure because the insurance company wants to make sure it's not elective, and that's a necessity. So what happens, women who have large breasts over a period of time will develop almost like a hump in the lower neck and upper back, in the thoracic area, upper thoracics, which are the vertebra below the cervical spine. And what happens is the breasts become pendulous, especially as women age. The age typically I see is 40s, sometimes 50s, very rarely in the 30s. And so the pendulous breast tissue will pull down and accentuate the curve, making that curve or a hump even more pronounced. And it can be quite painful. So you have um, when you have that hump in the thoracic region, it's unsightly for one thing as people get older. Um, Women will tend to lose height faster because the discs get compressed and the thoracic discs aren't that big to begin with. So a lot of times people will come in with upper back pain, neck pain due to large breasts. Um, I don't do breast exams. I don't have to. I do the spinal exam. I take x-rays. But over a period of time, it becomes too chronic in nature that the women will elect to have breast reduction surgery. So, as a chiropractor, my notes have to reflect accurately the condition going on as it relates to spinal problems, the muscular problems, musculoskeletal issues that go along with large breasts. Most people think it's a great thing until you have it and you have these kind of aches and pains. So it can be a problem for a lot of people. And the area gets affected is the upper thoracics. The thoracic vertebra are a different curve orientation than the cervical or the lumbar spine. It'd be actually the exact opposite curve orientation. So what happens is you need to basically go to a chiropractor for an extended period of time. Usually, like a 6 month period, not 6 months of active treating, but enough visits over a period of 6 months to show that you've done due diligence, you've tried to correct the problem naturally without going the surgical route, because it can be a very expensive surgery. Some women just elect to pay for it, but a lot of times it will be paid with the proper notes. And a lot of times I'm called on to do these notes or actually to review them for insurance companies themselves. So it's a service that we provide. There is no breast exam. Again, I do not need to I won't do a breast exam. But what we do is we do a thoracic exam, a musculoskeletal exam, and make sure that the skeletal system is, if there's an issue there that can't be addressed because of the large breast tissue, large amount of breast tissue, and the stress it places on the thoracic spine, that gives the insurance company more credence and they're more likely to pay to have the surgery performed. So it's not something you see every time, but I mean, it's basically 10 to 12 times a year. Either I'm getting notes to review or I'm doing notes for a patient. So it's not a something fast. It really tends to see, uh, but when the problem becomes more chronic in nature, will they allow for it? And it also takes due diligence in the note taking and giving, so that the insurance company can understand the severity of the problem and how it impacts the quality of that woman's lives and why surgery would be a beneficial thing. Because believe it or not, chiropractors can't help everything. If you've got thoracic spine pain due to large breasts, you might get intermediate relief at times, palliative relief, but you're probably not going to get that lasting relief. So, if you ever have any questions on it, please feel free to give us a call, 203-656-3636, 203-656-3636. Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. Hope you learned a little bit today and have a great one. Thank you very much. Bye now.